Okay, this is the third of 4 trainings of PSE work for fiscal year 2020. Today's topic is on Create Healthy Pantries. I'm Casey Coombs. I'm the Assistant Director of the program. And during today's training, we're going to talk about why we do work in food pantries. It was actually the first PSE intervention to be developed by our program. So it's been in place, or components of the Create Healthy Pantries, strategies have been in place for about 3 or 4 years at this point. We'll talk about Create Healthy Pantries approved strategies, how to get started in your pantries, the Healthy Food Pantry Assessment Tool, how to report our work in pairs, and then some time for questions and comments if you had them. Usually, or as always, these trainings will be recorded, and I encourage you to review them as you're working through the year if you have questions, but also always feel free to reach out to the state office. So why food pantries, or why a lot of our programs? We know that food insecurity is defined as inadequate access to sufficient amounts of food that allow for an active and healthy lifestyle. And I think a lot of times when people are defining food insecurity, they forget that last part of active and healthy lifestyle. It's not just about having enough food or enough calories. It's about having enough of the right foods that are going to allow everyone to live an active and healthy lifestyle that's going to lead to a happy, healthy, long life. We do see food insecurity in every county nationwide, which may be surprising to some, but it is in every county. In Utah, we have about 11.5% of our households, or 1 in 10 households, is considered food insecure, and about 1 in 6 children are considered food insecure. We know that at the federal level, there are several different nutrition programs that are geared towards reducing food insecurity in our neighbors and counties and communities. Those are the SNAP program or the WIC program, the child nutrition programs, the school breakfast or school lunch. There are many different senior feeding programs, Meals on Wheels, and the child and adult feeding program. There's another C in there that I can't remember what it stands for. And then also our commodity food programs. But despite those 3 federal nutrition programs, we still know that many people still struggle to make ends meet. And I think one of the major reasons for that is most of those, if not all of those nutrition programs, are defined, are income eligibility based. So if people make under a certain amount of money, then they would be eligible to receive those programs. But we know that a lot of people who maybe aren't eligible for those programs still may not make enough money to purchase enough healthy foods for themselves and their families. So in a lot of these cases, they are turning to food pantries, food banks, soup kitchens, and other emergency food sites. In addition to the food insecurity, we know that people who use food pantries are at an increased risk of poor diet quality, which could lead to an increased risk of many different chronic diseases. In adults, we see higher risks of obesity, type 2 diabetes, heart disease, and certain types of cancers. And for food insecure children, if they're food insecure during their developmental years, that when compared to their food secure counterparts, they have worse academic performance, higher BMIs, poor emotional development. All of these things can impact them throughout their entire life, even if they become food secure as adults. Another reason we focus on food pantries is because over the last 10 years or so, there's been a pretty significant shift in the role of food pantries. So historically, food pantries would be a short-term supplier of foods for individuals or families that maybe were experiencing some dire situations, maybe a loss of employment or an unexpected expense. But so maybe they would go there for a few weeks or maybe a couple of months. But we've seen people now relying on food pantries as part of their food security strategy for the month, either for several months or years at a time. So when people were only going to food pantries for a couple of weeks or even a few months, it wasn't that essential that they had access to healthy foods. They probably weren't going to develop any nutritional deficiencies or have long-term consequences of not having, a My Plate balanced diet for those short periods. But as they're relying on them longer term, it's become more and more essential that they have access to healthy foods at these pantries. Over the last 5 years or so, there's been a lot of research on pantry offerings, and there was just a meta-analysis published last year that found pantry offerings often inadequate to support a balanced diet, which really is not that surprising to a lot of people. The vitamins that were most lacking are vitamins A and C, so things that are available in a lot of fresh fruits and vegetables, as well as calcium. There were limited fruits, vegetables, and lean proteins offered through pantries, as well as limited fresh dairy products. They may have some shelf-stable dried milk and things like that, but when you're looking at fresh milks and yogurts and cheeses, there are really not very many available often. So in addition to offering inadequate amounts of healthy foods, there's also been a paradigm shift among pantry managers that we've experienced here in Utah just over the 4 years that we've been doing this type of programming. And a lot of food pantry managers used to, and a lot of them still do, are when you approach them about making healthy foods more available to their clients, they are like, our clients are in these dire situations and nutrition is not a priority for them. We just need to make sure they have enough food in their bellies. And there's something very valuable to that. But knowing that an unhealthy diet over the long term can really reduce the quality and even length of life for individuals, it's just becoming more and more important that these at-risk individuals have access to the right amount of calories, not just enough calories. And it is something that pantry managers are starting to kind of come around to, or even coming to on their own. So that's an exciting change, allowing for us to do our Create Healthy Pantries work a lot more easily throughout the state. So 2 years ago, I guess, as part of my thesis, we did some research in 6 food pantries along the Wasatch Front. And we really wanted to find out, as you would approach a pantry manager, they'd say, again, this isn't something that our clients feel is important, and it's not something that they value. So we wanted to ask food pantry users themselves if making healthy choices in the food pantry is important to them. And 93% agreed or strongly agreed with that statement. So this is a really powerful number to go to food pantry managers with and say, yeah, not just as a CBH ambassador or myself as a registered dietitian, do I think food pantry users want access to these foods. The clients themselves are reporting that this is something that they value. So this kind of gets pantry managers' ears opened a little bit more. We also wanted to have a better understanding of what food pantry clients felt were the barriers to making healthy choices. So they had a selection of 6 options they could choose from. And the most commonly reported barrier to making healthy choices in a food pantry was, not so surprisingly, that healthy foods weren't available. So just not having them there as an option. The second most commonly reported barrier was there weren't any times to compare foods. So anyone who's been to some of our larger pantries anyway throughout the state know that they move a high volume of people through in a really low amount of time. Pantries are often volunteer-based, so there's not a lot of people to help. So the number of hours they're open within a week can vary greatly. So clients didn't feel like when they were standing in the pantry, they had time to look at all the pastas and identify which one was the whole grain, even if they knew how to do it, or which can of tomatoes had a lower amount of sodium. Then we're looking at other. The most commonly reported other, where they could just manually enter a response, was if there was fresh produce available, it was almost spoiled. So by the time they got it home, they often didn't have time to use it before it was totally rotten. And then we had unsure how to identify and unsure how to prepare healthy foods. So again, things as the Create Better Health program, we can certainly help food pantry clients overcome. And then most interestingly is the last 2 very seldomly selected options where they don't like healthy foods or they're not interested in healthy foods. So again, just more fodder for our approach to food pantry managers of why these types of interventions may be really valuable and of interest to their clients. We also asked them program components of interest, so what types of program components they felt would be the most helpful to make healthy choices easier in the pantry setting. And you can see at the bottom, the most commonly selected component were shelf signs or labels, which we use often in our program. We'll show some images of those, followed by recipe cards and posters, and then nutrition or cooking classes and recipe samples, which I found it very interesting that recipe samples fell towards the bottom, but they didn't feel like those would be the most valuable program component to make healthy choices easier. We'll talk about the role of recipe samples in our PSE interventions. They have a very important role, but they are in conjunction with other components. So the implications of this research were to suggest that pantry users value improved access to healthy food. There's limited previous research on their perspective of healthy food access. We just had an article accepted to the journal National Extension Association of Family and Consumer Sciences about this exact topic. So we'll share that to everybody as soon as it is published. And then the other implication is that multi-level interventions that improve healthy food availability, access, and individual knowledge would be the most effective. And that we gained from looking at those commonly reported barriers. So healthy food availability, so increasing the amount would help overcome that barrier. Access, so making it easy for people to identify them so that they didn't have to take a lot of time to compare products to identify the healthy foods. And then individual knowledge of how to identify and how to prepare would help overcome the four most commonly reported barriers. So we have our Create Healthy Pantries strategies, so approved for our grant for fiscal year 2020. Down below, you can see we have three main strategies: healthy food drives, which includes our buy dinner or produce for your neighbor programs, community garden work, and then our Thumbs Up for Healthy Choices in Food Pantries nudge program. We know, as I mentioned, multi-level interventions would be the most effective. So hopefully you will find yourself in a pantry situation where you could do more than one of these strategies to help improve availability and then the visibility and appeal of the items. So getting started, identifying pantries in your area. So any pantry is eligible for SNAP-Ed programming, so that is nice. There's not a great place to go and identify food pantries in Utah. You can kind of Google it and you'll get a long list, but I don't by any means think it's an exhaustive list. You can also contact the Utah Food Bank to identify pantries in your area, but they would only be able to give you the names and locations of pantries that they provide food to, which is not all. It's many, probably most of the pantries in Utah, but it's not all of them. But your best source of that information would be your supervisors, your partners within the community, participants, just to find out where the locations are, or you may just be familiar with them. Some things you'll want to consider when you're identifying pantries in your area are the hours of operation. Again, a lot of them are volunteer run, so there's some pantries that are open like 1 day a week for 3 hours. Or I know in some of our rural counties, there's some pantries that are open once or twice a month, and maybe it's for the entire day, but you'll want to make sure that hours of operation coincide with the hours that you're able to work. And then the other thing to look at with pantries is what type of model they have. There's really two main types of food pantry models. There's called the client choice model or a prepackaged bag or box model. These are not, client choice is the official name, but the prepackaged box or bag model is not the official name, but it's just how they serve their clients. So within client choice pantries, it's set up kind of like a grocery store, and clients have the ability to move through the pantry and select items that they would like. So it's often based on household size. So you'll see signs on the pantry that say 2. So 2, 3, or 4. So based on your household size, you would pick 2 items from that shelf or that area, or 3 or 4. Sometimes they'll have unlimited areas. Or the pre-packed box or bag is your family will go and they will just receive a box of food or a bag of food that the pantry has prepared for that individual or that family. So you can see in the pre-packed box or bag model, people have no say in what they're getting, which often results in food waste and continued food insecurity, because if there's items that they don't want or don't know how to use, then it's not really helping their situation. So a lot of pantries are actually moving to this client choice model. it is something we could, in theory, work on, helping a pantry that was interested from going from this prepackaged model to a client choice pantry, but it is definitely a very large undertaking. So if a pantry you're interested in working with is making that change, you could use some of your time to help, but it's certainly not something we could do on our own. So once you've identified the pantries in your area, I guess I should say, if you're interested in doing like the Thumbs Up for Healthy Choices program, it's really designed for a client choice pantry, but there are some ways you can adapt it to the other models. And the healthy food drives can benefit any type of pantry, as well as the community garden work. So just know the kind of model your pantry does. If you have multiple pantries and your choice of them, I would probably choose working with the client choice pantry. But that's really up to you and your program. So as you identify your pantries, you'll want to introduce the Create Better Health SNAP-Ed program. A thing you'll really want to let them know is all of the things that we do are in pantries intend to make healthy choices easier to make without reducing the options available. So, they may have a large section of bakery items from grocery stores that are donated to them. And they don't want to not offer those to their clients. That's totally fine. That's not our goal. Our goal is not to reduce the amount of those options available. We would just want to make sure they have access to healthy foods if that's something they're interested in. You want to assess their level of interest. So approaching a food pantry manager, maybe you don't even want to approach them with starting with PSE work. Maybe you want to say, we offer these classes in the community. Can I set up a booth to recruit for classes where I can offer recipe samples? Another thing, if you're doing recipe samples, you may say, what are some options that fit our healthy nutrition criteria, which we'll talk about here in a minute, that you have a hard time moving? And maybe they have 300 pounds of lentils, and that's something they're having a hard time moving off their shelf. So if you offer the option of, I'll create a recipe, I'll do a booth in your waiting area, I'll let people sample the recipe, and then hopefully it would increase the likelihood of people taking them. So it's kind of a win-win situation. They'd help move product that's kind of plateaued, and we can get our foot in the door. So just any way you can really start building that relationship from the ground up. If you go in and approach it as, you just have a lot of junk food to offer your clients, and we want to come in and make your pantry better, you can imagine that's probably not going to be received very well. So just go in and kind of assess the level of interest. If you have a pantry manager who, when you start talking about healthy food access, are on board, then the sky's your limit. But if you have one who you feel like is a little bit more tentative, start with some of the other options we can offer through our programming. So as I mentioned, we have all the 3 different strategies you can do for the program. So the first one, that first barrier that people most commonly reported was there weren't healthy foods available. So we obviously need a strategy to help increase the availability of healthy foods. So for that reason, we have healthy food drives that happen throughout the state. They happen in a lot of different levels. We have a partnership with the Boy Scouts of America, the Trapper Trails Council, which serves northern Utah, as well as some locations in Wyoming and Idaho, maybe? I'm guessing probably Idaho. And they've allowed us to print for the last 3 years on their bags, all families deserve access to healthy food. While all foods are appreciated, please consider donating the following items. We developed this verbiage and this list of items from a food pantry coalition that I'm part of that has probably 8 or 10 food pantries represented. So these were items that the food pantry managers themselves thought would be beneficial, like on a large scale, to request. So low sodium canned vegetables, canned fruit, and 100% fruit juice, whole grain cereals and breads, low sodium soup, etc. So that's a really large scale one that we do here in northern Utah. There's been some successful food drives that have partnered with the Utah Department of Health, so reaching out to your health department educators. You'll hear in a lot of these trainings just encouraging partnerships with the health department, and they just have a lot of similar program goals as Create Better Health SNAP-Ed does. So it's a natural partnership that allows us to increase our reach and leverage our resources and really just expand our programming on both sides. We've done some food drives in extension offices. So right in your office, especially with the holidays coming up, just setting up a box for a food drive and requesting those healthy options can be a great way to just, every few hundred pounds really can make a difference, especially in some of our smaller rural areas. When you're doing these types of food drives, you really just want to make sure that people don't feel discouraged from donating other options, because we know a lot of people, when they get a food drive bag, myself included, I'll go to my pantry and I'll select items that maybe haven't been used or that I have a lot of. So we don't want to discourage anyone from donating, but we just want to encourage them to consider donating some of these healthier options, just under the concept that everyone deserves access to healthy foods. We've had some counties do store-based food drives, so they'll run these food drives right in the grocery stores. So a lot of times, especially around the holidays, you'll see the drop boxes right at the exit, where shoppers would just purchase extra items and then drop them in the box before they left the store. So you can do this type of marketing right in the store. You can make little grocery lists that people could have with them as they go through the store of the items that you're requesting. If you're doing a food drive for a specific pantry, you can work with that pantry manager to identify foods they would like to receive. An example of this was in one of our counties, the pantry had a ton of bread, so they definitely didn't want whole grain breads listed on the list of options to consider donating. Two other options for healthy food drives are buy dinner or produce for your neighbor. Healthy food drive. These are healthy food drives that are conducted at stores or farmers markets, and both of these were ideas from two of our ambassadors. So great job. They just saw a need in their community and a way to make it happen, and they were both really successful programs. For Create or buy dinner for your neighbor, it was run in a small rural grocery store in Wayne County, and the educator there would pre-package like dinner bags with all the ingredients to make a dinner, usually using non-perishable items. And the idea was a consumer could buy one for themselves if they wanted, and then they would purchase an extra bag that would then be donated to the food pantry. So that worked great. And then here in Cache County, the Buy Produce for Your Neighbor program is run at the local farmers market, and it encourages patrons to purchase additional fruits and vegetables to be donated to the pantry. And that one, another benefit of it is, as the program got started, some of the vendors who didn't want to bring their produce home would donate their excess produce at the end of the market to go to the food pantry. And that's a really great one, because as we noticed, a lot of food pantry clients said even when there is fresh produce available at the pantry, the quality is usually really poor. So having people donate right at the market and then delivering it immediately to the food pantry into a refrigerator and then having it distributed just a couple of days later, they're going to get the best of the best, which is really what we want for our participants who are using these services. And all of these materials, let me go back here, these food drive posters you can find online under the PSE website, and you can edit them to request the items that you're looking for. We still have to get them all updated with our new logo. If you want to print flyers for food drives to hang with bags, just reach out to us. It's something we might be able to help with. These banners, we would be happy to provide them for your county. You would just have to send your food pantry logo if they wanted that on it, and your farmers market logo, or whatever logos you wanted and how you wanted the program to run. So all of these things we are happy to provide for you. You just have to reach out and let us know that you are wanting to try these programs in your area. Community garden work to benefit food pantries is another thing we can do. Some people have just partnered with their community gardens, and they will set up like a day to collect excess produce, so the gardeners can either leave it there in coolers provided, or they'll know on Thursday Create Better Health will be there to collect anything they're not going to use and donate it to the food pantry. We've had some educators grow a row for the hungry, so actually cultivating rows intentionally for the food pantry, so that's another great one. And then we've had some gleaning opportunities available where you can partner with gleaning organizations and get that fresh produce to the pantry as well. And these are all great, not only to increase access and availability of these healthy foods at pantries, but it also significantly can reduce food waste, which is another really important part of food insecurity, getting that so much food waste that we have redistributed to the people who need it most. It's a win-win. The third strategy is our Thumbs Up for Healthy Choices. This is our nudge toolkit, and the goal of this program is to improve the visibility and appeal of healthy choices in food pantries. So here is an example of one of the marketing tools. These are 6 or 8 foot banners you can get that can either hang in the pantry or are standing banners, and it's making healthy choices just got easier. And looking for the thumbs up sign, find foods that are high in vitamins, minerals, and fiber, and low in sodium, added sugar, saturated, and trans fats. The Nudge Toolkit, the Thumbs Up program, is based in behavioral economics, which is essentially understanding all of the different behavioral factors that influence an individual's economic decision. So the basis of behavioral economics was in like a retail setting where people were actually purchasing food. So that's where the economic decision comes in. But in these client choice pantries, even though there is no money exchanged for it, the same types of factors go into the decision-making process for individuals. But perhaps will be slightly easier to influence because there isn't that money barrier. So, a lot of times people will say it's too expensive to eat healthy. So the food pantry kind of takes that out so we can influence these other factors in the same way as we can influence the economic factors or decisions. There's multiple factors that influence these food decisions. So immediate versus distant gains. If you're looking at something for convenient foods for convenience versus this is going to have a long-term health benefit for me, people tend to choose things that have more of immediate gain. Access to pertinent information. So if we want people to make healthy choices, we have to give them the information right at that point of decision. So we have to make sure they have the information they need to make the healthy choice if that's something they're interested in doing. And the ease of decision making, it has to be easy. When people are making behavior changes and sustaining behavior changes, those first stages, it's got to be an easy choice or else they're just not going to do it. That's kind of generalizing, but in many cases, if the decision is easy to make, the healthy choice is the easy choice, people will be more likely to do it. So it's all based in nudge strategies. So increasing the visibility and appeal of certain items, we encourage or nudge individuals to make a certain choice. So here's a little Simpsons cartoon where the fresh fruit is now at that point of sale where the donuts used to be. And Homer's noticing that the donuts are way over there. So they're not so accessible and so easy to make. So he thinks he'll have fruit. And then the owner says, my cunning choice of architecture will soon have Homer eating healthy. So this is just this is Nudge Strategies 101. Not limiting choices, just making the healthy choice the more visible and easy choice to make. And there's a lot of research that shows just that simple product placement strategy will have a significant effect on a lot of people. The strategies in the nudge strategies that we use in Thumbs Up are product placement. So this Homer example, product promotion using shelf tags to help encourage people to select those things, and then product price is obviously not one we use in food pantries, but it's a common nudge strategy that's used to influence food decisions. These strategies have been used in retail settings forever. So it's when they have the brand names right at eye level or on the end cap. Companies pay more money for those locations because they know that people are more likely to choose them for no other reason than their location. Or the sugary cereals, the brand name sugary cereals are at the eye level of kids. So we just want to use those strategies to encourage healthy foods. So that's a relatively new field, and then using them in food pantries is even a newer field. So the Thumbs Up Toolkit is available on our PSE website under Thumbs Up Materials. It outlines the implementation of the program. It gives you some ideas on how to approach the pantry managers, so some of the things we talked about earlier. The available tools that you can order from the staff from the state office. The nutrition guidelines that foods have to meet to be considered a thumbs up or a healthy choice. Product placement strategies you can use in your pantry, how to report thumbs up, and then contact information for our offices and the local health department. The health department, several educators throughout the state have adopted this program, so we wanted to make sure both organizations have the contact information for each other. So the nutrition criteria, you'll see there's categories for every food group. So we have fruits and vegetables, grains, proteins, dairy, and then we have an other category that's like snack foods and mixed foods. All of the criteria here are on a per serving basis, so it should be easy enough to look at the criteria for something to get tagged thumbs up. And look at the label, which is also on a per serving basis, and kind of line those up to see if it fits the criteria. As you're going through the items to identify those healthy choices, you want to just make sure you're paying attention to words like and or. So in this fruits and vegetables category, when you're talking about canned or dried or frozen fruit, you don't want any hydrogenated oils and sodium and total sugar, the three things you would have to consider. Or you can look at packed in light syrup versus that total sugar. So just pay attention to those details of and or. So the program components, the main component are those shelf labels identifying the healthy choices. So you can see here, here's a pantry that chose our perpendicular shelf tags, so someone could look down the aisle and see where all of the healthy choices are. So you can imagine it helps them overcome that barrier of not having time to compare items to identify the healthiest ones. And you can see this one here is on a canned fruit that's packed in light syrup. We have posters also available in English and Spanish. We have recipe card templates. So if you want to put a recipe card next to an item they have a lot of that meets our nutrition criteria, you can do that. Our information cards are cards that should be set up where people are signing in for the food pantry so that they can learn about the thumbs up sign or the thumbs up program. Also available English and Spanish. Those banners are available to order, and grocery cart signs. A lot of our pantries have grocery carts for people to use to fill their baskets. And if you think about a grocery store, there's often those little like essentially frames at the front of the cart where you can put an insert, and we have a reminder about our thumbs up program that you can put in there in English or in Spanish. And all of these things are available to order on the staff website. Here's our shelf chalkers. We have a variety of sizes. We have 1 inch square shelf chalkers. We have, I don't know, it's a 2 or a 3 inch. We have 1 by 3 inch if you wanted to sit flat against the shelving, just a lot of options. We have this cam green bean is what is called a shelf educator, and that when we first developed the program, we thought just telling people it was a healthy choice would be enough, but we quickly found out that food pantry clients wanted to know why it was a healthy choice. So available on the staff website are these shelf educators that have, I think there's about 25 of them of commonly available healthy options in a food pantry. And it says, you know, what's healthy about them, what they contain, and a way to use them. So you can print those out. There's also a template. You can create a new one if there's an item that we don't have available that you need for your pantry. Down here below, these longer strips, ideally, if you want to make healthy choices easier to make, you'll want to separate out those healthy choices. So if you have a shelf of canned tomatoes, in an ideal world, you'd be able to separate out the ones that are low sodium or no salt added, and then mark that whole section with one of our big shelf tags of a healthy choice so people could easily see these tomatoes are healthier than these tomatoes. Often we run into pantries who aren't interested in us separating out like the low sodium canned items or the whole grain breads. And in those instances, they preferred these strips that tell people how they can make a healthy choice. So make the healthier choice by choosing low sodium or no salt added canned vegetables, or look for fruit packed in 100% fruit juice, or look for items that have 3 grams or more of fiber per serving. So we do have these available in English and Spanish. We know that a lot of our pantry clients have that barrier of not having time to compare items. So this isn't my favorite option because it's not making that choice the easiest choice. But this is an okay option to get your foot in the door at the pantry. And if this is what they're most interested in, then by all means go ahead and utilize them. But I would encourage you to move towards having sections of healthy foods being really easy and available for them to select. We have the banners and the handouts. These are just images of them that are available to order. We need a little bit of time on the banners. Sometimes they have to order the supplies to print them, so give us, about a month's heads up before you would need those. Additional components, that product placement and display is really important. We had a county in Salt Lake. They worked with one of their pantries, and before their work, when you walked in, the first thing you saw was that huge rack of bakery items from the grocery store. And they actually got that moved to the back of the pantry, so it's still there, still available, and just replaced that with a fresh fruit rack. So that was a great example of a product placement or display option that they could easily change. A lot of our educators like prepackaged recipes, so working with the pantry to identify what they have a lot of, and prepackaging and seeing, maybe they have the ingredients for a vegetarian chili, so they would pack all of those ingredients into the bag, put a recipe card in one of our Create handouts, and maybe do a recipe sample at a nutrition booth in the waiting room and say, hey, these are all things that are available in the pantry. Have them taste it. If they enjoy it, they could just take that recipe bag home with them, and they have at least one healthy meal until they're able to visit the pantry again. Some counties like to do nutrition or cooking classes right inside the pantry. Sometimes there's an option for that. You can imagine a lot of times people want to get in and out of the pantry really quickly. So I think there's just 1 or 2 pantries where that's actually been successful. But if you have other classes set up in the area, I'd encourage you to recruit at the pantry for them. That would definitely be our target population. And doing food demonstrations and samplings, again, in the waiting area is a good way to let people know about our program. A required part of Thumbs Up is doing a regular booth in the pantry. So you could do a recipe sample, but the main point of the booth is to inform clients about the Thumbs Up program. So just letting them know that it's there and what it means and why it's important. The other thing we found in our research, and I didn't share a lot of details here, was we found that the Thumbs Up program was very effective for people who knew about it, but we found that a lot of participants did not know about it. So knowing that it is effective, we wanted to just make sure that all of the pantry clients were able to take advantage of the program if they chose. So that's why we started making those big banners and the grocery cart signs and the handouts. So we have a lot more marketing techniques, but we also know the best way to increase awareness of something is for you to have one-on-one interaction with the client and say, hey, when you're in the pantry, look for these signs. This is what it means. This is why low sodium options are important. This is why low added sugar options are important. Just sharing that information with them so they can make informed decisions. If you have these booths set up, again, recruit for classes, do a recipe sample, anything to engage the clients and just help build awareness of Thumbs Up and create better health in general. To track our work in food pantries, we have the Healthy Food Pantry Assessment Tool, which is an environmental scan tool. So again, these tools are all meant to assess healthy food access in the pantry. You'll probably notice if you're using, it's a pretty lengthy tool and there are a lot of things in there that we can't impact as SNAP-Ed. We probably can't take the bars off the windows or take the beer posters down. I guess that's probably more retail. But there's things that we aren't able to impact. And we still choose to use this tool because we hope that you share it with the pantry manager and it would give them ideas of other things they may want to consider working on independently or with our support in different ways. You'll do a baseline and a follow-up score. So you will use the tool to do a baseline before you do any work with them to kind of see where their starting point is. Again, these are not intended to compare. They won't ever be used to compare that pantry to another pantry. It's just a way for us to track the changes that we're able to make. So you'll use the same tool when you finish working with that pantry or at the end of the fiscal year, just to show, again, those improvements. There is a pretty lengthy walkability checklist that is optional. You don't need to do this part. The only thing I ask is if you don't use it and you score the walkability as 0, when you're reporting it in PEARS, you just state in the comment box that you did not use the walkability checklist, so that when you're doing it at the end of the fiscal year, or if another educator is doing the follow-up, they know that you didn't do it, so they don't do it, so that doesn't skew the scores. So this tool is available on the staff website. There is an instruction manual, and then there's two different versions. There's the paper copy that you could print out and just manually fill out, or there is an online copy, and this would be the most efficient for you to do. You could take your iPad, which has a data package, so you wouldn't need to have Wi-Fi available in the pantry, and you would just link to it from our staff website, and then you could just enter their scores, check the 3 or whatever the question's asking. You can select your response to it, and that would generate an automatic score for you. So that's the easiest way to do it. If not, you have the paper version, so you can either do the paper version and then manually add up the score, or you could take your responses and enter them into the online version and have that generate the score. So there's different options for you to do it. We also encourage you to take the baseline to identify what the pantry is doing well. So you definitely want to focus on what they're doing well at first, and then look at the other improvements they could be making and see what they're interested in doing. Starting with just 1 to 3 goals to start. Okay, my last section is the Create Healthy Pantries PEARS entries. So this, there are detailed step-by-step instructions in Section 8 of the Protocol Manual, so I'm not going to go through this with a lot of detail today, but I wanted to point out a few key pieces. You will do 1 PSE entry in PEARS per pantry. So even if you do all 3 strategies, you're going to just do 1 entry for that pantry, because all of those strategies are improving the food environment in that pantry. You'll update it throughout the year. So as you are making new changes, as you're adding new interventions, as you're at different stages of implementation, you will just go in and just continuously update the entry. And we see all of those additions you make, so we know that you're continuing to work at that site. You won't mark it as complete until the end of the work. So maybe that's 6 months in, you finish your work, or you decide that you're not going to work there anymore, so you would mark it as complete at that point. Or if it's a pantry you may work with for a couple of years, you would mark it as complete at the end of the fiscal year, so in September. You also don't want to mark it as complete until you have those 2 scores in, that baseline before you do any work and that follow-up score. This is just screenshots of the instructions in the protocol manual. A couple of things I wanted to point out. On the general information page, there's this comment box where we ask you, this is where we ask you to just put in what you're doing on a weekly basis. So, or every other week, however often you go to the pantry. Say, here's an example of October 25th, I collected excess produce from the community garden and delivered it to the pantry, and that took 3 hours. On November 2nd, I replaced the shelf labels and packed recipe bags, and that was 2 hours. So this just allows us to see what you're doing kind of day to day. I think it's one of the limitations of the PEARS PSE entry is it's very big picture. So it's great for some components, but the comment box is really just to allow us to see the ways you're using your time as an ambassador. The needs, readiness, and effectiveness section, this is where you're going to enter those scores from the Healthy Food Pantry Assessment tool. It has a spot to select that tool as your survey tool from a long drop-down menu. And you will enter your baseline score, and then before you mark it as complete, you'll enter your follow-up score in that same section. Some of the other areas, one of the hard things of the PSE entries is I can't tell you exactly how to select or which changes to select or which interventions to select, because every PSE location is really different. So throughout this entry, it just talks about ways to think about how to respond to the questions. So the changes adopted, it states this will depend on what projects you are doing. And then down below, it has our 3 different improved strategies and some of the changes adopted that you may select based on the specific work you're doing. So you'll just go through their very long drop-down menu of options and choose things that reflect the work that you're doing. Reach, this one for food pantries. To determine the reach, the best thing you can do is to talk to the pantry manager about how many people they reach, whether it's in a month or a week or however they measure how many people they reach. You want to use that information for these entries. If they won't share that information with you, you would just put an estimated of what you think, and tagging it as estimated allows us to know that it's truly just estimated and it may not be completely accurate. And then, yeah, everything else is just in the protocol manual, all of the other details. So are there any questions or comments at this point?
I'm always full of questions.
Let's have them.
So this is kind of a general, because we just went through a lot, and with the last training, you covered a lot of other programs we could do. If I were an overwhelmed ambassador trying to figure out what would be the best course of action, would the first thing be to talk to my supervisor to see if there's some new thing that, or a program that we can implement somewhere that would be good? And then if they didn't have an answer or they weren't sure, then we would go to, do you think, the health department? So we're trying to not duplicate efforts. And then after that, contact individual organizations such as food pantries or farmers markets or whatever it may be. And obviously talking to the state office in the event that there's some new PSE strategy that is not one of the approved ones. Is that the proper course of action?
Yeah, I think that's a great course of action. I think absolutely talking to your supervisor first. They have huge networks of within the counties, so that's the #1 place to start. And then beyond that, you could reach out to your health department, or you could just reach out to your partners. I'd say those are kind of lateral moves, so whichever you are the most comfortable with. Yeah, I'd say you summed it up pretty nicely.
Awesome, thanks.
Yeah. Yeah, and reach out to us. We can certainly help you get started. Okay. Well, we will get this recording on our YouTube channel. And again, feel free to use it as a refresher, or if you're a supervisor, encourage your new ambassadors to watch it as part of their onboarding and let us know how we can help.